like to call tonight, September 24th, 2024, tonight's meeting to order of the Pittsburgh City Commission. All rise for the flag salute, please. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Reverend Tom Werman, would you come up, please?
Thank you. I invite you to join me in prayer. Living God, our Creator, you are above all and through all and in all. We give you thanks for the blessings of this day and for the ways that you have blessed our community with its beauty and resources. And we thank you too for the blessing of each other. As we gather, we ask that you grant us eyes that see and ears that hear that which is truly the best in each other. We pray for your blessing upon this meeting. Grace our civic leaders with your spirit of wisdom, humility, courage, and peace, that they may promote the common welfare and hear the voices of all who reside in our community. Guide them in all of their decisions, that they may be faithful models of leadership and service for all of us. For to you belongs glory and dominion, now and forever. Amen.
Thank you. It's not on the agenda, but have a special proclamation. I'd like to go ahead and read this, and I'll present this to Jay Byers when I'm done. Proclamation, whereas the first episode of Sesame Street aired on November 10th, 1969, and you can already tell this is going to be very serious. Whereas Sesame Street has reached its 55th season providing educational children's programming, and whereas Sesame Street is watched by almost half of all American preschool-aged children, and whereas Elmo, Abby Cadabby, Cookie Monster, Big Bird, Oscar the Grouch, and many other friends, who I'm going to include Snuffleupagus for the benefit of Tammy Nagel. Many other friends, because we talked about that. Many other friends who've been a part of children's lives for over half a century, and whereas Sesame Street Live, Say Hello, will be coming to Pittsburgh Memorial Auditorium on October 1st, 2024. Now, therefore, I, Stu Hite, Mayor of the City of Pittsburgh, Kansas, hereby change the name of Pine Street from 5th to 6th Street to Sesame Street for the first day of October, one day. So, we have the complete with the sign and everything, so.
All right. Cool.
October 1st, Memorial Auditorium.
Shameless plug, get your tickets now, so, October 1st. All right, I'll open this up to public input. Anyone with public input, please come forward, state your name, address, and limit your comments to 3 minutes, please.
I'm going to hand this out real quick.
Sure.
Thank you.
Hi, Roger Lomchak, 1147 South 220th Street. Before the timer starts, if it's okay, I have a quick question. When did the commission adopt the 3-minute rule? Was there a vote on that?
That was this year, and I believe it's just in the interest of time.
Well, I understand, but I mean, was there an actual vote on it?
Yeah, I don't know, I don't think there was.
We don't vote on that, and sometimes it's the mayor's discretion.
And
So you just can make rules?
and we actually don't have to have public input, as I understand it, so,
We're not required to.
You're not required to have public input at all?
correct.
Okay, well, interesting. I didn't know that. So a couple of things real quick. I dropped off some questions last week, or last meeting, that I hope maybe we can have some answers to later this evening or now, if any of you are willing to entertain questions on that. What I've dropped off is some information on local residency preferences. HUD, I'd asked the question last week, and initially Henry had thought that it's not something we're allowed to do, and you're right in the sense that obviously you can't discriminate on the usual basis of race, religion, etc. However, federal law does allow for any organizations that issue HUD vouchers to set up what are called local preferences, so that you can say, okay, we're issuing HUD vouchers, however, we're gonna give significant priority to anybody who's a local resident, who's been here employed for 6 months, been a student, had some kind of combination of situations that demonstrates that they are not just a person who's come here. Federal law actually explicitly allows a restriction to prevent somebody from just coming here after being issued a HUD voucher. You can actually include that as well. There are a number of citations in here. Also, within these pages I've given you are a number of both policy changes for the Pittsburgh Housing Authority, which would include that in the Pittsburgh Housing Authority annual plan that would implement local residency requirements that do meet federal law, as well as a number of what I'm terming good neighbor resolutions, which are obviously not mandates, because you can't force an organization who you're not funding to do something outside of zoning requirements. But what you can do is ask them to adopt similar measures in the interest of community protection and preventing some of the situations we've seen where a significant number of criminals have migrated here on their own or with assistance, who knows, but have come here with the purpose of finding assistance and have ended up committing more crimes here and adding to our local stresses, including, as we found out, I think something like even 40% of the police calls, that's the number I heard not too long ago, 40% of our police calls have to do with the homeless in criminal situations. If that number's wrong, I'm open to being corrected, but I believe at one point
Did I
that's
tell you
correct.
that? I'm sorry.
I honestly don't remember if that was you or somebody else, but that's been a number I've heard tossed around quite a bit.
Yeah, I'm not.
Anyway, it's
I'm
a
very
significant
confused on
amount,
that one, but-
whether it's that much or not, it's a significant amount that's taxing our resources quite a bit. In terms of zoning restrictions, I know it's been suggested that, not formally, that Wesley House has some kind of zoning allowance for the homeless operations. I understand and I vaguely remember that there was an entire zoning process done for the food pantry, which is honestly an appropriate thing to be located there. It helps out people all over the community. We've heard that the homeless operation is a completely separate situation in a case like that, where it's obviously created a significant amount of friction both in that neighborhood. It's hurt housing values. It's made the neighborhood hostile to kids being able to move freely around or go to parks, and it's caused quite a few issues with the church. Even now, Our Lady of Lourdes just implemented a lockdown procedure with the church to restrict anybody going in who's unauthorized because of the situations that have happened, on top of all the stuff that's happened with the schools.
Your 3 minutes actually ran out, but
Okay.
the alarm didn't go off. But
All right, well, I appreciate you letting me go on.
Thank
If there's, are you all aware of any zoning allowances that permitted the homeless operations where they are?
We can address that.
can
at the
address it
end,
at the end.
Everything else.
Stick around.
Okay, yeah, I'll stay here. All right, thank you very much.
Mayor, at the city
Name-
commission meeting on
Name,
September.
address.
Yeah, Gary Dennett, that's D as in Delta, ENNETT, and I live on Woodland Drive in Pittsburgh, Kansas. At the city commission meeting on September 10th, 2024, there was an encounter after the meeting between you and myself. I would like to address this to the governing body. I'd gone up front to share with Commissioner Mansell how I personally appreciated the questions he raised and the issues and my comments to him. Without any provocation, you made it your business to inject yourself into the discussion and begin to get out of control regarding my comments you overheard. You stated you were not going to you were not going to sit by and let anyone criticize your performance as a commissioner and wanted to set things straight. I wonder if at that point you realized your poor performance, unable to criticize yourself, you exploded at me. You even repeatedly, in anger, threatening and verbally abusive way, challenged to confront me outside. I believe that was meant as to be a physical altercation. The last time I checked, I think I have free speech and I can say what I wanted to Mr. Mansell. I didn't realize just how out of control you were until, and how your actions had spiraled negatively, until I looked up and there was a Pittsburgh police officer at the meeting was standing in front of you, and I assumed he was there to protect me and probably whoever else. As a city official, this is no way for you to settle disagreements, and certainly not socially acceptable. An elected official should not treat the citizens he represents in such a manner. It's abuse of power to be so arrogant towards others that you may think or express that they may think or express their opinions that you differ with. Therefore, as your poor judgment was fully exhibited on September 10th, I request your apology to the constituents, including myself, and ask that you should resign from the commission and give careful consideration as a police officer, the PSU who carries a badge and a firearm. After all, what could go wrong here? And to relieve yourself of duties, since you can't control yourself, and your behavior, which would seem to be essentially important to a person in a stressful and sensitive situation. That's it.
Hey, my name is Christy Bittner and I reside at 1508 Bittner Court. Commissioners and City Manager, I come to speak about the 2025 Pittsburgh submitted budget. It was not possible for me to be there at the public hearing regarding the budget. There are some issues of concern I would like to address to you. First of all, the City Manager submitted the budget to the Commissioners on July 23rd. It was disappointing that the budget was not on the city website before the end of July for citizens to be able to study what was being presented on their behalf. It was also a disservice that the budget calendar was not followed in the month of August to at least allow a discussion between the city commissioners concerning the budget. It would have been on record for all citizens to listen to what the commissioners had thought about the budget. I myself have noticed many errors, omissions, and unexplained changes within the budget. One example is the year used in many pages is not for the year 2025. As I reviewed the commission meeting of July 23rd, several items discussed by the finance director and the city manager were puzzling. It is clear on page 29 of the 2025 budget book and the notice of budget hearing that the number for the year's mill levy evaluations do not reflect what had been adopted in previous years. In the July presentation, the assumptions presented is for the sales tax to see 2% growth for the years 2024 through 2028, yet the 2024 growth was flat and no growth for 2025 was stated by the city manager in the September 10th budget message. How can it be both? It appears that our population has turned downward in size since 2024, which is the wrong direction and not growing as we continue to hear. In the budget book, our numbers of households have not increased, the number of firms have not changed, nor the number of women-owned firms. PSU enrollment has lost 126 students, and our public and private schools have unchanged enrollment for the last 2 years. In the budget summary under reserves, the general fund budget balance and the public utility fund balances are missing items C and D that have always been included in previous years. In the resources graph on page 27, the first thing to notice is the percentage is missing. The total budget for 2025 is $68.7 million, which is a remarkable decrease of $6.7 million from last year's budget of $75.5 million. The expenditures for interfund transfers and reserves are missing on page 35 for the 2024 and 2025 budget books. On July 23rd, the city manager stated the 23 expenditures were $40.3 million. The 2023 budget book shows it was $42.4 million, and the actual net expenditures for 2023 in the notice of budget hearing states it was $46.5 million. In the 2025 allocation by purpose, the public utility expenditures percentages do not match from the previous page. It was stated in July that the outstanding debt service was $32.6 million for 2023. The 2023 budget states it was $30.4 million, in 2024 it was $25.9 million, and in 2025 it is $27.8 million. The resources allocation numbers on page 54 do not correspond to other sections of the budget book. The engineering and public works line item is missing altogether. Under the city manager's division, it was startling to see the significant increase of the adopted 2024 budget of $653,630 to an increase of $4,490,364. The largest increase was to the estimated contractual services. This change seems extremely out of the ordinary. Continuing on through the budget book, one can see the numbers are most
Christie,
concerning for their
time.
inconsistency.
I'm sorry to interrupt, but your time is up.
I'm almost finished. Not enough time is available during public input to describe the examination of the 2025 submitted budget. I felt this needed to be brought to the Commission's attention and to re-examine the approval of a budget with so many errors, omissions, and unexplained changes. Thank you for your time.
Thank you. Any other public input? Seeing none, I'll close it and move into the consent agenda. I entertain a motion to approve the consent agenda A through E.
Move to approve. Second.
It's been moved and seconded that we approve the consent agenda. Roll call vote?
Brooks?
Yes.
Height?
Yes.
McNeil?
Yes.
Munsell?
Yes.
Sigley?
Yes.
All right, consent agenda is approved. Special presentation, Crawford County Mental Health. Representatives from Crawford County Mental Health will provide an overview of the services offered at the newly constructed Addiction Treatment Center located at 3103 North Michigan. Good evening, Blake.
Good evening, Mr. Mayor, members of the Commission. As you mentioned, we are pleased to have with us tonight members of the Crawford County Mental Health Administration. They're here to talk about the new Addiction Treatment Center that opened a couple of weeks ago. For those of you that attended the ribbon cutting, I made sure to point out that the city was a partner in this project. The revolving loan fund contributed $400,000 to the project because the EDAC felt like it was not only a project that was great for the community, but it had a big workforce development impact since some of those that they serve at this facility are employed by our local businesses. So overall, I know on the initial estimates it was going to be a $6.5 million project. I think it was closer to $7 million toward the end. So the city's share was a small share, but the city was a partner in this and very proud that it's now across the finish line. So I'd like to call up Heather McCauley with Crawford County Mental Health. She'll walk us through some of the details of the project. Heather.
Hello, I'm Heather McCauley, the Executive Director. Thank you, City Council, City Administration for letting us come, share a little bit about our agency and report on the expenditures that we used the Economic Development Funds for. So a little bit about our agency. We were founded in 1961. We achieved our CCBHC certification. That's a Certified Community Behavioral Health certification in 2023. And currently we have a little over 250 employees. Some of the services that we have: same-day access, crisis intervention, adult services, children's services, substance use treatment, medication-assisted treatment, veteran services, site testing. So 2023 by the numbers, last year we served a little over 2,600 clients with almost 125,000 services. Addiction treatment services was the top number 3 service provided there. 87% of our clients live at or below the federal poverty level, 51% are Medicaid or state funded, 31% are uninsured, and 27% are underinsured. So the history of the facility came in 2016 from some town hall meetings when there was a need found in the community to expand addiction treatment services and for crisis services. So the fundraising construction, Blake almost had it right. When we started this before COVID, it was $2.4 million. Then COVID hit, and right before that, we were about 94% fundraised for it, closer to about 4 with the soft costs. COVID hit, and then on the other side of that, it was $8.5 million without soft costs. So the total project's closer to about $9.5 million. So we appreciate the city helping out with it. The economic development was definitely needed. So like I said, it expanded our addiction services added beds to 32 and 7 crisis beds. The facility, got an extra 0 there, it's a little over 19,000 square feet. I was doing this today. And we will have 65 staff in the building with 30 of those positions being new. So it's a lot of economic development that's coming to the facility and to the area. So it's going to be located at the Richard H. Pfeiffer Recovery Complex. That's 3103 North Michigan. It's going to house 3 different services. The same day access, that's a program that we started in March of 2023. We're just relocating it there so that we have one access point. So no matter what service you need, you walk in one door and you're connected to that service. So same day access is walk-in clinic for a mental health intake. We get you connected to services, no appointment needed. Since we started in March of 23, we've had a little under 1,500 intakes, and that's about a 67% increase annually from when we had them scheduled. The 2 other programs, substance use disorder treatment, we have that currently, but the new facility is allowing us to expand and add additional services. October 1st is when all of our clients will be moved over, in place, staff there, and services begin to start. And then the Crisis Intervention Center, that is a brand new program that we've never had, it's never been regionally around, and it's actually a brand new licensure from the state that just occurred this year. So we're working on program development and applying for licensure for that. So I'm going to turn it over to James Childers. He is our Chief Program Operator for Residential Services. He runs the Addiction Treatment Center and our Veterans Programs, and he's going to talk to you about the funds that we used from the Economic Development, talk about the facility. He was instrumental in making sure it stayed on track and that all of the anti-ligature furnishings and all of those things were in place, and then also talk about programs and services.
So we want to thank you guys for the support that you had. Obviously, $8.5 million is quite a bit of money to raise. So we have $190,000 that went towards security systems, and so that's with the lockdown facility. It helps us keep those clients safe and locked into the facility if they're a risk to themselves. It also prevents those clients and staff from being able to access various areas of the building, and so like it's an electronic monitoring system. Also with that, we have a security system or cameras to make sure that people aren't doing things that they shouldn't, or if something happens that we can go back and look and make sure that we're doing the right things to provide the best level of care. We had $250,000 in furnishings for the facility. We made sure that what we put in the facility is going to keep the facility looking as good in 5 years and 10 years as it does today. And so it's a little bit of money up front, but I want a place where people can come in and have a sense of dignity and respect, because that's an essential component in rebuilding your life. Landscaping costs, and we still need some furnishings to wrap up, but we're getting really close to being done with that stuff, and it's just like the last like 3 or 4% that we're going to continue to do moving forward. All right. So here's some pictures of the facility. You can see the north side of the facility, that is on our dining hall, and so we're going to have some outdoor picnic tables in that area, so when the weather's nice or clients want to, they can go out there and have lunch or in the evening sit out there. We also have a fenced-in area in the back that they can sit, which will have some picnic areas. I'm going to jump over to the cafeteria and main space on this side, so that's what the picnic area connects to. And you'll notice that there's a, maybe you can see, but there's a wall in the middle of that, so we're able to close off that room. We'll use that for groups for the clients, but we'll also be able to close that off and provide group space for the community groups, as well as a meeting center when we need to do stuff as an agency. And so it's really a multi-purpose room. The other group room that's below it, so I'm from Joplin originally, and our facility got hit by the tornado, and so this room here has, I believe it's 10 inches of concrete on top with multiple I-beams, and the walls are solid concrete, so we have a FEMA rated safe room in there that also doubles a group room. The residential command center in the middle, that's where our techs work. You can see down all the hallways, you have clear line of sight of all the areas that the clients may be when they're in treatment, with the exception of the cafeteria, which is also one of the group rooms. You can look at the residential rooms. All of that looks like really nice wooden furniture, but that's actually like a thick roto-molded plastic that's built to last, but it looks nice. So we have in each room 2 wardrobes, 2 beds, and then 2 desks for the clients to work on. If we roll over to the bathroom, you can see that all of that is epoxy floor and epoxy wall for the showers. All of the furniture throughout the facility is ligature resistant, so if somebody attempts to hang themselves, the doors will come off, the showers will come off, like there's nothing that they can put weight bearing on. We want to do the best that we can to ensure that the clients are there to receive treatment. And then on the back side of this command center, what we don't have is a picture that leads into the CIC or the crisis unit, and so we built it so we can function as a team. So wherever the need is, we can get staff there in a rapid manner. So the available services, we've increased the capacity by 33% for the clients that are there. The collaboration with same-day access is going to be huge. So throughout the state, if somebody calls and they want treatment, it's not uncommon for them to be told that we can get you a bed in 2 months. And that frustrates me, because when somebody needs a bed, it would be like going to the ER with a broken arm and being told that we'll help you in 2 months. We can do it today. What we've done with the model is we have moved to a rapid access. I'm ex-military and I believe in a triage model. And so we have established our program in that manner, so when somebody walks in, if they need something, we can get them help today. With the same-day access, they can get an assessment today. If they need psychiatric services, as of October 1, they will be able to walk in and get that today. If they need detox, they will walk in and we can get that today. There's no reason that people need to wait for services, and we have effectively eliminated that wait at this point in time. I believe that the wait time to access our services is like 0.4 days or 0.2 days. It's just a few hours. And we're measuring from the time they walk through our door until the time they're done, not from the time that they see somebody. So if we measured it from the time they saw somebody, it would be 0.0. So by doing the central location with SDA crisis, SUD services and the psychiatric services all in one spot, when somebody walks through the door and they need something, our staff can identify this is the need, here's the person that can do it, and if it's a routine outpatient thing, it's going to be maybe across town, but they don't need it. But anything that's crisis related, we can do right now. And I think that's a huge statement, because nobody else in the state can say that. So on-site psychiatric and detoxification services, not only can we serve the SUD population while they're in treatment, but with a nurse practitioner joining our team, we're going to be able to treat the mental health issues while they're on the unit getting services, as well as the SUD services. And we have counselors that will be able to round and be a part of all of that. So we really are touching the clients quite a bit with all the things that we can do.
I think that's me. My name is Eric Thomas, and I'm a psychiatric nurse practitioner by training. So I'm a nurse practitioner board certified in psychiatry. I am new to Crawford County mental health, but I've spent the last 5.5 years practicing in Southeast Kansas with Community Health Center. I'm here this evening to talk about the Crisis Intervention Center, but a point I want to make, over the last 5.5 years, I've had patients that I've thought, man, it sure would be cool if I had somewhere else to send them besides home. For a lot of reasons, some of them being they'll end up in the emergency department if I don't have that other place. They'll end up in our jails if I don't have that other place. They'll end up in the streets if I don't have that other place. And the Crisis Intervention Center represents that other place for people who are experiencing an acute psychiatric emergency. And so as the doors open up, we will start as a crisis stabilization unit. And the regulations for that are a little bit different, but I want to be fully transparent. The crisis stabilization unit is designed as sort of a hybrid between inpatient stays and outpatient care, which means 23 hours is as much time as one admission will get on the crisis stabilization unit. And why that matters is because even though 23 hours is a lot of time to get them connected to resources, get them a variety of things that they may need, it's still not quite inpatient level care. And so in my career, I've spent 4 years working in patient psychiatry. So what I'm currently working on, and Heather's doing all the heavy lifting and James are doing all the heavy lifting right now, is we're working on getting a certification as a crisis intervention center, which is tentatively scheduled for fall of 2024. And the primary difference for that is that this would be a higher level of care that would allow for involuntary admissions to this facility. And so what that would do is give a resource for our law enforcement officers who are out in the street that maybe they don't need to go to jail, or maybe they don't need to go to the hospital. They can receive acute psychiatric care at a different facility that is going to be very cost effective comparative to the other areas. A crisis intervention center is going to provide 24-hour a day, 7-day a week care to folks experiencing psychiatric or substance abuse issues. The reason why there are still question marks in this presentation is because the regulations were published at the end of June of this year, and they weren't widely spread until about 4 weeks ago. And so as James and Heather were working on this idea, they were thinking about what could be coming, what does this community need, and the state caught up with the identified need. So we're going to be offering 7 beds to individuals in need of help. They're going to get access to same-day psychiatry care, 24/7 nursing support. Psychiatry providers will be on call. They'll get access to group therapy, acute addiction treatment needs. Also be a place where they can, get back up on their feet if necessary. The thing I want to emphasize is this facility is designed for everyone, regardless of what they're facing. If it's a psychiatric need, we will be here to help support them. That's the primary admission criteria, is if they're experiencing acute psychiatric emergency, or a place that they can go. If we've identified individuals that are going to require longer-term placement, Kansas has put together kind of a flow sheet that will help outline the process. So for folks who are familiar with the bed availability at our state hospitals, there is none. And so the crisis intervention centers are going to work to try to divert folks from having to go to the state hospitals to hopefully in time open up beds. But for folks that we anticipate that will require greater than 3 to 4 days, we will work on procuring a state hospital bed to where we can keep these beds open for the community who needs them. And I'm happy to answer any questions that may come up from the commission.
I have a few questions. You have a psychiatrist on staff?
Our medical director is a psychiatrist, yes, and then we
Here in
have.
Pittsburgh?
He lives in Kansas City. He was in Pittsburgh for a while, but he lives in Kansas City now. And we have 4 nurse practitioners that work closely under him.
In the center?
Yes, yeah. There'll be 1 in this facility, and we have 3 in our outpatient services that provide psychiatric prescribing for adults and children.
So who will be able to do the prescribing? The nurse practitioners?
We have 4,
Okay.
yes, and Eric's
What
one of
about
them.
Psych Ds? Do you have Psych Ds on the staff?
We have one. We have one doctor and clinical psychologist. The rest we have other clinical mental health licensures, so social workers, professional counselors.
Okay, you said that you have 24 hour.
Mm-hmm.
So there's somebody available?
Mm-hmm.
So if the emergency room calls and says we've got some potential patient for you, there's somebody to come out and assess them, or they have to be sent there to be assessed?
Well, we already have 24-hour assessment for if we need a screen. So we can go out to the hospital now. What we're working on is the protocol and the process for can we divert from jail, can we divert from the ER and bring those that are appropriate straight to our facility to just even cut that out. So that's the protocol that Eric and James are working to develop that we'll be rolling out to our community partners.
Okay. My last question is that all the nurse practitioners who are available to you are all CLS and ATLS trained?
Sure what.
I don't know
That
what
licensure
CLS
is.
is referencing.
Acute cardiac and acute trauma, in case somebody decides to slash their wrists or anything like that, you have people who are trained to do that?
No, we will not be doing ACLS services. We'll have BLS and call for EMS. It's not very common. I worked inpatient for 4 years. It is not common that psychiatrists have ACLS because we don't have a crash cart on the unit.
Okay. What do you do if somebody's bleeding out?
Apply pressure, call for help.
Right.
Okay.
Right. You're right. It's the CIC is a new model and a new regulation, so it is confusing that people feel like it is a medical hospital. It is a psychiatric facility for inpatient for short term. So we provide all the psychiatric services, but not primary medical. So it is a different way of thinking of it.
Which, Dr. Sigley, to your point, one of the challenges that we're going to run into, one of the things that I'm thinking about as I'm trying to sleep at night, is how are we getting medical clearance? And so when we talk about diverting directly from law enforcement, when we talk about diverting directly from other facilities outside of an emergency department, right? Medical clearance is the concern of mine, because a law enforcement officer, they don't know. There are things that may be going on inside of the patient that we can't see with our physical eyes, that's building. And so as Heather's mentioning policy and protocol, those are the things that we're working through. To the best of my knowledge, there is one CIC in the state, and they converted from a hospital designation to a CIC level designation. So this is really cutting edge new thing for the state of Kansas.
Okay, what about involuntary? I mean, how does that happen? Does a judge have to intervene?
Yes, it has to be a court order from a judge, correct?
Okay. Okay.
I want to step in also though and say that a tremendous amount of effort was put into the design of the facility, line of sight and all those things, and we go through everybody's belongings, and I know we can't eliminate that possibility. We have done our best to reduce that.
I'm recounting from my experiences
Sure,
in the past.
absolutely.
Okay?
Yeah,
We're
absolutely.
trying to cover every hole here. that's
I
possible.
appreciate that,
Right.
yes, absolutely.
Thank you.
I got a few questions. So, here in Pittsburgh, and this is not uncommon, all over the United States, we have the homeless issue. Do you know the percentage of the homeless, and I know there's two definitions for homeless. There could be homeless people that are living in homes that they relative, but there's homeless people that are living on the streets, and that's the ones I'm asking about. So do you have a percentage of the homeless that's living on the streets that have mental issues or addiction issues? Do you know the percentage?
Happy to speculate if that's all right.
Sure, and I have data from our
Oh, yeah.
clients that are, go ahead.
Yeah, so I just went to a homeless training in Salina last week, and some of the statistics that they were reporting, 60% are suffering from a known mental health condition, which was low, right, when I was surprised. But there are also folks who may have an unknown mental health condition, but also have a substance use problem. And so the way that they were reporting the statistics, they were reporting them separately. 60% for mental health, 30% for a solo substance abuse issue, which puts the homeless population 90%-ish experiencing either a substance use or a mental health
So you're
condition.
90% homeless could have some mental health or
Yeah, I mean,
Do you, excuse me, Chuck, do you identify or do you do toxic studies when they're entered? Urine studies, blood studies, stuff like that to identify if they're on?
yeah, so the Crisis Intervention Center has not opened yet. Right now, we're finalizing regulations with the state. But yes, part of our protocol will be doing, searching for that. And that's all data that we can absolutely report on a programmatic level, not a patient level, of course. But we can, we'll be tracking that information.
So I got several more questions.
Great.
And I've seen our police officers getting calls and responding to homeless issues, individuals. And what I've seen is they're kind of standing back, the individual talking, doing whatever. Are you ever called for assistance? Because I know you guys, Crawford County Mental Health, Addiction Center, and probably Community Health, are more trained than our police officers. So do you ever get calls to respond down there, maybe help with the situation? Maybe you know the people that they're dealing with? What do you do?
Sure. So we have a 24/7, 365 mobile crisis department. We have forever. It's 232 safe. So when someone's experiencing a mental health crisis, they can call. We've worked very closely with law enforcement ever since the state hospital put a moratorium on beds and the availability became zero. Before that, you used to be able to have a screen determine there was a bed need, drive them there that day. Now there's nowhere for these individuals to go, and thus the CIC. So we've worked with law enforcement for that. Another program that comes into place with CCBHC is Assertive Community Treatment. That's an ACT team, and that identifies those high utilizers in communities. So mental health, we have a team of mental health providers, so it's a ratio of 7 providers to 1 client. They meet daily and they talk about these clients. How do we route services around? How do we do prevention services? They can also interact with law enforcement and with the hospital, with EMS, of course with releases of information to identify these individuals. So when they do call, when they call EMS or when they show up law enforcement, they are identified, they know who they are, and they can call us and we can come out and help. We can go on calls with police, and eventually the hope with the CIC is if that's a call, they can be diverted if it's appropriate and medically safe for them to come to the CIC.
Have you responded by request from Pittsburgh Police?
Yes, we have.
Okay. And this is their 32-bed facility.
It's 32 for addiction and 7 for crisis.
So how long is the stay in the facility?
For residential addiction or for crisis? Either one?
Yeah.
Okay. So addiction is a 21 to 28 day stay. And for crisis, it is a 3-day stay, but it can be extended if necessary. The idea is it's a short-term stay to de-escalate, to regulate, to get that individual out of a crisis situation. But if it's determined that they do need hospitalization, then that's where you have that time period to keep them in a safe environment, get them treatment, and find a bed.
So after 21 days, you could determine they don't need any more treatment, and what happens to them then? Are they, if they're homeless, where would they go?
So we would not determine that they didn't need any treatment. What we would say is they would be stable enough to start to engage in outpatient. So when they're in the inpatient, we work to try to find housing for them, to get them interviewed at different housing places, to apply for different stuff. And so we have people working the whole time that they're in to try to do that. But the research would say that for treatment to be effective, they need to be engaged for probably 18 months. So like inpatient is really just a place to get them stabilized enough to be able to start to utilize those other resources. But part of that is finding housing and stuff like that. But we have people come in who may not want that. So we do the best we can to move them along that continuum of recovery.
So you're talking about housing, now you do own some apartments on Michigan, Crawford County Mental Health, is that where they would go, to those apartments?
James, do you want to talk about reintegration services?
Yeah.
So we do have women's reintegration services, and so the ATC is a 21 to 28 day. At women's reintegration services, we can keep them there for up to 3 months total. So during that time, it's for people, for females, people who have children and whatnot, and we have a little bit more time in that modality to work with them, and we have some stuff in the pipeline to expand those services for males as well.
If somebody's in your facility, they can check themselves out, can they?
They can.
So whether they complete the treatment or not, they can leave, and they could be back out on the streets, and we're having to deal with law enforcement. Residents is dealing with the same issue over and over. But I know it's a hard call, but
One of my hopes is that we can have a more robust medication-assisted treatment program through ATC. This is something that we've done in partnership with Crawford County Mental Health through my work at Community Health Center. And there's a lot of reasons why people leave treatment. There's a lot of reasons why people relapse. So, very few amounts of them are people just out there seeking to destroy their lives, right? There's a ton of stuff that goes into this. Medication-assisted treatment gives an opportunity to help meet some of those short-term needs to prevent a relapse, help them finish treatment, and then when they're stable enough, psychosocially stable enough, they have a place, they have a support network, all those other things, we can look at getting them off of medication-assisted treatment. And so I think in time that may help get people to finish treatment. We saw a great improvement when I started doing medical detoxes for alcohol use disorder through ATC, and I don't think we have those specific numbers, so you'll have to take my word for it. But we had more people completing treatment, which was really refreshing. They're not white-knuckling it in a shower, having to come off of this stuff. More robust psychiatry, medication-assisted treatment will help with that. So.
Could you tell me, I'm sorry, the crisis stabilization unit, what's the maximum amount of days they can be there?
Yeah, so it's designed, and Heather can trump me, of course, because she's the boss. It's designed as more of an outpatient modality, so 23 hours. So think of it as kind of this rapid access to care, right? So Heather mentioned the assertive community treatment programming. This is something that has been successful in the state of Missouri, where we can get people in, we can get them started on medications. Maybe I can convince them to take a depot antipsychotic medicine to where if they become homeless, they won't have to keep taking pills every day. Get them embraced in services and then help them in the next leg of their journey.
So do you envision once you get them out of crisis, do you see them being put into the ATC side of it?
That's absolutely an option. Part of the crisis stabilization also has that flexibility to include substance use emergencies as well as behavioral health emergencies. And so James and I have already kind of talked about what coordinated care may look like. Even though we're in the same building, we're probably going to be running around busy, but talking about how we can transition folks over. Even once the crisis intervention center becomes a thing, involuntary holds 3 to 4 days, right? We could still look at getting them psychiatrically stabilized and then feed that into ATC so they can specifically address their addiction treatment needs. It's like a chicken and the egg situation.
And with the case management peer support that we have on the unit, when somebody comes in, we're gonna get an assessment to figure out if there's housing and things like that. So even if they don't want to do inpatient SUD treatment, we'll start working on trying to find them housing and stuff, because our goal would be not to have them done, but if they choose not to follow through with another inpatient treatment, we want to follow through with mental health. And if we can get them inside, get them on some medications, give them a glimpse of what it might be, hopefully we open the door up enough. And sometimes it takes people 3 or 4 times of doing that, and sometimes it's the first time. So like, regardless of when they come through, the goal is going to be the same every time. We try to get them stable and try to give them options.
How do you not keep it from being a spinning door? You say, I mean, really, it just seems like that they're not made to stay.
Yeah.
You can't lock them in,
Yeah.
but they're there. Then all of a sudden they don't think they need it, and out they go again, and
Unfortunately, the revolving door, there's too many people that need services for this truly to be a revolving door.
Sure.
Right, because if
Sure.
Bill leaves, I'm gonna have Joe right there.
Sure.
Which means Bill just can't come back around and hop back in, right? And unfortunately, James is the expert with this. Part of the job of the therapist and the counselor, and this is coming from a medical provider, so I can say this, nursing provider, part of their job is to get them to change their thought process. I've got the easy job prescribing medicine. James has to figure out what motivates that individual, and sometimes he doesn't figure that out the first time they come in.
so
Right.
once they're in, they're just not committed for the 28 days that you're talking about.
So here's what I would say is that with addiction, there's a lot of stigma and there's a lot of judgment that people face. And so maybe the first time they come in, all that they get is they can come in and there's no judgment. So when they go back out, it's easier for them to come back in the second time and there's no judgment again, and we're just gonna tell you what it is. And they could go back out, but it's hard to not absorb a little bit of information. And so if we create a non-judgmental environment, they come back in. And that's all we can do. And so like the model that people are talking about and have been for a few years is harm reduction. So we're not saying that they never use again, but if somebody goes out and they stay clean for 3 months, that's 3 months that of improved functioning. And if they slip, not necessarily does that mean inpatient. Maybe it means that we work on stuff outpatient, right? So like I compare it to diabetes. If somebody's doing good and their blood sugar's level and then like all of a sudden it goes out of whack, you don't have to, the treatment wouldn't be to do something really intense. It would be if we can stabilize it with like minimal stuff, right? So I think that we use medications on the outpatient basis to help with that. We do all kinds of things. If it gets severe and there's a diabetic coma, then we put them inpatient, right?
Mm-hmm.
So like if it gets severe enough that they need to come back in for intense treatment, but our goal is to be able to do it in the community because it's kind of a sheltered environment on the inpatient unit, right? And I think about boot camp and I didn't have drill instructors picking up the barbed wire and saying, oh, sweetheart, like, it was like kind of what it is. So when they're in the community and they're dealing with stuff, they're bringing those real life stressors in, and that's what we work on to be able to tolerate and deal with those things in real time.
So the 232 safe number that you said, 24/7, 365?
Yes.
And you're going to get somebody on that line every single time?
Yes, it is answered 24/7, 365. After hours, we do have an answering system. So you call that, it's a statewide used, and if there is a need for an in-person screen in our community, that rolls back to us and we send out a therapist to go do a screen.
What determines the in-person need just by a phone call?
The situation, the people that are answering that call, they're trained professionals and they will know if they can do a screen telehealth, if that's appropriate, or if we need to send someone out to do it in person. Sometimes it depends on if the individual has technology issues or a disability that doesn't let telehealth work. Sometimes it's just a matter of, we know this client, they're on the ACT team, so if they're identified on the ACT team, we have to respond in person. So that's one of those benefits of having those services wrapped around individuals in that community.
So Heather, some of the CCBHCs across the state have been able to get into transitional housing and permanent supportive. Is that a goal of your organization?
Yes, so the facility that we used to house the addiction treatment services in, we're looking at turning that into supported housing. We're working on a couple different grant opportunities. We're gonna partner with CCAP because we are not a homeless shelter. We are not housing, we are a mental health provider. So they are the experts in that, and we've had a long-standing collaboration with them to do other programs. So we're working with them for grant opportunities. We're working through the state. They just got a federal grant that they're working on supported housing that's getting ready to roll out. So we've got some grant applications and proposals in place, and that's our hope, is to remodel that to have supported housing.
Great, thank you.
Yeah, Don, I think you and I went on this trip
Yeah, we did.
together. So Lawrence, just for people who aren't aware, they have a cool concept of single unit housing for transitional housing. And the mental health center's role is they partner to help support the grant procurement, right, to get the money. And then I think it's the local housing authority, or maybe
Right,
another name,
yeah.
that is the ones who actually built it, manage it from a housing perspective. And then the mental health, they send their case management, they send all their treatment providers to those single unit homes to ensure that they're getting access to care.
It's pretty sweet.
Yeah.
With all these services in this county, I can't believe we have all the problems that we do. It just seems like it's all out there, all they gotta do is take it.
I think one of the things too is this has been kind of an explosion of opportunity, you know, and I'm saying this as an outsider, right? Heather and James have done an incredible job, the funding resources that they've been able to procure. That's a big deal. Like a lot of the stuff we presented on tonight has not been here historically. And so hopefully we can start to see the turn of the tide a little bit.
Great.
Okay.
Thank you very much.
Yes,
Thank
you.
you, appreciate it.
All right, under non-agenda reports and requests, bi-monthly budget review, Director of Finance, Allison Ramsey will provide the August 30th, 2024 bi-monthly budget review. Good evening, Allison.
Good evening, Mayor and Commissioners. This is our bi-monthly budget report for August. We are 67% through the fiscal year. 61% of general fund revenues have been received, and 43% of general fund budgeted expenses have been expensed so far. Our street and highway fund has collected 72% of its budgeted revenues, and 62% of budgeted expenses have been expensed. The Economic Development Revolving Loan Fund has received 71% of budgeted expenses or budgeted revenues and expensed 45% of budgeted expenses. 68% of budgeted revenues have been collected in the Public Utility Fund, while 65% of budgeted expenses have been expensed. Overall, we have received 67% of budgeted revenues and expensed 50% of budgeted expenses. Are there any questions?
I don't have any. Anyone else have any?
I think the good news is, and thanks for Allison for pulling us together, we brought in 35.3 million, and we spent 31.7. So at this time of the year, we're not upside down, but the cash comes in as it comes in from the state and other areas. But for the most part, we're on plan, and we'll probably do one budget amendment at the end of the year. Obviously, we stood up a trash utility out of nowhere, so that's going to have to be, the money for that has to come from somewhere. So you'll probably see a budget amendment in December, maybe November.
Yeah, you'll see the budget amendments for that, for the trash service, and those transfers for the trash service to get that started off, and then like a couple special parks funds and stuff that we adopt based on receiving more income than we expected on the submitted and adopted budget for '24. So we'll do that in the next few meetings.
So are we pretty much where we usually are this time of year in terms
Yeah.
of the budget?
Yeah, we are, and you can see that most of our revenue, it might look like a little bit less besides for the Public Utility Fund, which is like a consistent stream of revenue, so that's like right at expectation with 67% of the year complete and 67% of revenues collected. You can see the other ones might be a little bit lower, but that's because of when we get those property tax distributions and those higher revenue sources, and they're not distributed on an even basis. Those are distributed 4 times a year, and so that's why that might not look as even, but that revenue comes in at different times, and then that meets up with the expenses. So we're right on track like we are in other years.
Sure. Thank you.
Good job.
Darren?
That's a pretty good segue. So, Mrs. Bittner came up and asked about the budget. The budget, the budget that we submit to the state that you approve and that you pass and then send on is actually just a form that has all the funds. It's kind of similar to the one you see in front of you. It has very little detail. It's fund by fund, and it lets people know what we started the year with in a fund and then what we spent during the year. The budget book, which is about 1 inch thick, is actually published as a courtesy. It's something I brought with me when I came here. We didn't publish a budget book, but the only thing we published was a bunch of schedules of something that looked like the mid-year. So we had Jamie here. He fought it for a little bit, but we put together a budget book, and basically in that book, it gives you a lot of different ways of looking at the programs that the city funds. And for the most part, we try to put a lot of words in there and describe the services, but we do also include the positions, and we include beginning balances and ending balances. That book is published usually when we do the submitted budget, my submitted budget. This year, I've got a hard copy of the budget in my office. Allison has a hard copy, so we worked off the hard copies. It actually wasn't until the night before the budget that I had a question to myself and went online and looked, and I was like, that's last year's budget. So brought it to Allison's attention. Obviously, we have new employees, we have limited resources. We do the best we can, but they publish the correct budget the next day. I would encourage anybody, the reason we publish that budget is because looking at the schedules, a bunch of numbers, unless you're an accountant or a government accountant expert, it really is meaningless. So we try to put it into a document that you can actually understand. And when you do that, and you have 3 staff people, you have a potential for errors. So like in Kansas City, there was 25 people in our budget office, and we had to read the budget from beginning to end to make sure every word was correct. And here, we have Allison. I think I looked it over once, so I apologize for any errors in the document. The biggest apology is that it wasn't even online for the first month when it should have been. Had anybody noticed that, I think they hopefully would have brought it up before today and said, hey, the budget's, I don't have it. We would have given them a copy, emailed them a copy, had them come in and get a hard copy. But the budget is a courtesy because we want people to understand what's in it. So if it's confusing at all, we've made some pretty big changes. I don't know if anybody knows this, but Allison is actually an accountant. She's working on her CPA. I think she has part of it already. Her view of government accounting is completely different than Jamie Clarkson's view of a government accounting. So she is, in a nice way, convinced us there's a better way to do accounting. So, and Mrs. Bittner went pretty fast. I wrote as fast as I could, but I didn't get anything down. So please come in with all your questions. We'll be happy to walk through them. But the ones I heard were the transfers are way down. When we collect money, Jamie would collect money, and then he would transfer it into a fund, and then he would transfer it from that fund to another fund. Well, on the books, that looks like it's twice as much money. So when the budget drops from like 72 million to 67 million, it's because Allison is like, I would think we should just collect the money and transfer it into the fund that we're going to spend from. And that is just one example of a lot of things that Allison has brought to the table. So I have no doubt the budget looks different. I also have no doubt that the printed budget probably has things that aren't reflected either accurately or they look weird, especially with the titles of what fiscal year you're in, because it's very confusing to pay all the bills during 2024 and be working on a budget that's for 2025, and you've got 3 columns. So no excuses aside, our aim is that that's a very good document. It has great information in it, and it's a way to generate discussion to people that don't understand the numbers. But by all means, if you look at the budget, we had it out there for 5 weeks and it doesn't look right, just tell us. That's why we have so much time between the submitted budget and when we actually ask you to pass it. So apologize for any of the confusion. Be happy to answer all of your questions. Obviously can't do it today because I couldn't write fast enough. But I'm very proud of her, and I have a feeling Allison probably has something she wants to say.
Okay, so I know those numbers vary a little bit because when we do this budget, we do it on 2023 actuals. Those numbers come in different, and same with 2024 estimates. We don't get that final valuation for property taxes until November. So what we just adopted for the 2025, that's based on an estimate that we have received from the county, and then we go in and get those actual numbers in November. So you are going to see a little variation in those actual property tax numbers received. And then same with 23. We might have budgeted a number, but does that mean we collected 100% of what we actually budgeted? Probably not, because you have people that are delinquent on that. So there's where you're going to see a variance in what was actually adopted and what we received. It's just because we don't have the actual number until November, and we have to get this adopted before October 1st. So, and then 2023 shows actual estimated is 2024. That obviously changes from what's adopted because we go in, we're already halfway through the year and we know, hey, these might come in a little bit more, these might come in a little bit less. And so we try to take those estimated numbers and just say, this is where things are actually coming in at versus what we thought that they were going to come in at on the adopted. And then 2025, that's what we expect to have in revenue, and then we get those final numbers in November. And then net interfund transfers are in the spreadsheet on the book. There's just not a cover page for net interfund transfers right now. And if you have any questions, feel free to call me and I can answer anything you might have. Like Darren said, governmental accounting is a little bit different. Those net interfund transfers are a little bit different this year just because we're not overstating revenue. We're not transferring it into one fund just to transfer it out of another fund and have multiple transfers. And this is just a decision that we made with our auditors before we made that drastic decision. So it might look like we're bringing in less revenue, but really we're not. We're just not overstating transfers.
And there is a section in there, it sounded like some of the things that Mrs. Bittner was talking about were the no growth, the population of the university. There's a little fact sheet that's like a 1 page where we try to put in information about how many households, what the median income is. I personally haven't looked at that page in 4 years, but
And we
I'm
review
assuming it
that.
hasn't been updated, it sounds like. Or
We do review that annually because we review it for our audit too. So we review household income and everything, and that's just based on what we're getting in census data and what we're getting in data collected. And if the data is not readily available to us, we can't give you an updated number because when we go to search that, we're given the same number. We do contact the schools to get enrollment numbers though.
But yeah, we had a discussion about 2 months ago, the population declined. Well, the article was referring to a different number than the census number, which is the census number that we use to reflect our population from year to year. So just please, if you have questions, and we don't mind answering them after the fact, but the budget's been adopted. But our goal is to be accurate, and our goal of that document is really to paint a picture of, hey, if you open it, you can see the city's didn't have a trash service last year, and they have a trash service this year. And the city is spending, we have 26 people that work in the Parks Department, and generally the parks expenses are either going up or they're going down, and we have graphs. But I have the tendency to want the budget to be perfect because I came from a place where we had a ton of resources to make that budget document perfect. Maybe we've bitten off more than we can chew, and we need to rethink, maybe we should just publish 4 schedules and call it good. I think it's important to have a program budget. I definitely want it to be very accurate, and we will get better. I'm not gonna sit here and chew anybody's tail about how inaccurate it was. I'm the city manager, it's my budget. I can tell you, the budget we submitted to the state legally is perfect, it's accurate, and the state's not gonna have a problem with it. The budget document is a monster, and we're always gonna be working on it, but I appreciate that. And I really would like you to come in, or at least submit the questions so we can have a chance to get you answers. Because A, there may be errors in there in the reporting of the budget document that we want correct, but a lot of it is probably, when you get the answers on why the number looks like that, it may explain to you what we've done with programs this year. We shift programs in between departments from year to year as the operations of the budget of the city change. So one year sanitation may be under Public Works, and the next year, for whatever reason, we may have to move it to the city manager's office. I don't know, but I think there's probably a good explanation for most of those. And if there's not, we'll find out. But I do appreciate you coming in, and I really appreciate you reading it. Because quite frankly, I was like, every year, I'm like, nobody ever comes in when we print the budget. But
You can count on Christie.
well, I haven't heard from her the last night. It must have been perfect the last 12 years, but this year, it sounds like we've got some issues, but we'll get it worked out. And thank you for doing that.
Roger, can I ask you to come back up for just a bit? Yeah, you submitted this local residency housing preference rules. What you're saying is, it would, in effect, implying that the city should adopt?
Well, that's, I guess, these are, first of all, just some information for everyone's benefit of what federal law actually allows. And in the past, I've advocated for residency restrictions, simply outright saying if you have not been a housed resident of Crawford County for a year, then you should not receive assistance. Instead, you should be assisted in getting back home in a humane way so that you can get reconnected with your safety network. By federal law, that's not allowed. However, what is allowed is to say that people who are not residents of the area with specific criteria can be put much lower on the priority scale of getting vouchers, rather than us simply saying next one in gets the next voucher. It's completely legal for the Pittsburgh Housing Authority as well as the other agencies, which which hand out HUD vouchers to restrict access to people with some residency requirements.
Would this increase the homelessness? Because some people are not going to qualify.
Well, part of, one of these situations, and we've had people attest to it on the Citizens from Pittsburgh page, that we've had homeless people on their state that they came here and slept in their car until they could get a HUD voucher, because they knew there were going to be available.
As I understand, HUD is, they have to pay a portion, and HUD pays a portion. Is that correct?
Well, I think we probably need to hear from our own staff before we.
I think there's a lot of stuff there that I'm honestly not the expert on what the split is, on how that's done. I know there's some type of scale based on a person's income that affects how much they're responsible for.
On these HUD vouchers, is it possible that somebody in another state could get a HUD voucher for that state and move to Pittsburgh?
I believe that's what's
Let's
called
hear from our
portability.
staff, Roger. I mean, I appreciate all the research you've done, but we have the people who are actually living in Pittsburgh. We need to hear from our own staff.
Thank you. Kim Froman, Director of Community Development and Housing, and this is Megan Keener, our Assistant Director of Housing, but she does the Section 8 program. Basically on the residency requirements, we obviously can't do that. As Roger stated, we can put preference on that. However, we cannot limit, I think he had asked to limit the amount of time that they had lived in Crawford County. They had to be there for like a year, and we cannot put a time frame on that preference. But again, it's not a residency restriction, it's a preference to those within Crawford County. And I can let Megan speak any further to that if I'm missing something. Go ahead.
So currently, the only preference that we have on our Section 8 waiting list is time and date of application, and that's most housing authorities' preferences. You can set all sorts of different preferences, but that also limits the housing opportunity. So according to the CFR, you can put a residential preference, but you cannot limit the time that they're in your jurisdiction. So if they come here one day, it doesn't matter if they're here for a year, a day, 6 hours, it doesn't matter. We can't put that residential. The other part of it is we have to have a local need and priorities. It also has to meet the consolidated plan. And according to the consolidated plan with the state of Kansas, residential requirements and preferences are not allowed. Or they wouldn't recommend them, and they wouldn't give us funding. So there's a lot of different components to putting a preference, especially a residential preference. Currently, right now, our waiting list is about a year long. So my office, the Housing Authority, is the only office that gives out Section 8 vouchers. So there's the only other one would be CCAP over in Girard.
And then, Mr. Mansell, your question was about can you restate it? If somebody came from another.
For housing from another state, could they use that voucher if they came?
Wanted to move here?
Yes. One day in Pittsburgh, they could, but you're saying local preference, is that what we're doing?
Right, so, but if, say, you received a voucher, a Section 8 voucher over in Missouri, you could port your assistance over here to Pittsburgh. We have no control over that. That is the right of the voucher holder.
The commission couldn't?
Well, it's a federal program.
That's a federal,
Okay.
all of this is, all of the Section 8 is federal funding.
And share again how long someone usually is waiting while they have the voucher.
Our current waiting list right now is a year long.
Yeah, so it's not like people are running to Pittsburgh to get a voucher to get housing because they have to wait. We don't have enough housing.
I mean, our current waiting list is a year, and you receive 90 days to find. Once you receive a voucher, you have 90 days to locate housing within our jurisdiction.
I will say we are lacking additional landlords to help support the program. So that is something the city of Pittsburgh would love to have more opportunities for housing. If we had more participating landlords, we could house more individuals that have a voucher if they would accept the Section 8 voucher.
I have a capacity of 443 vouchers. I currently only house 285 of those due to funding and lack of landlord participation. So we could have we could have a lot more vouchers, and that is why the waiting list then turns out to be a year long.
And again, I'm gonna ask the question, they have to provide a certain amount of funds, correct? They themselves?
Yes, so we do not allow our tenants to pay more than 30% of their income. So this is an income-based program. You don't have to have income. I mean, we would like them to, but we can't require them to. So yes, if they do have income, there is a percentage of the amount that they have to pay. They won't pay more than 30% of their income. So we pay a portion and then they pay a portion. And that's paid directly to the landlords every month.
Which is what we see in our appropriations.
Yes.
So to keep going on that subject, since we have the experts up here, we met on, Mr. Lomschek handed out a document last meeting. I think you referred to that in your comments today. We went through that. We tried to make it clear at the last meeting, but I don't know if anybody understood. We sat down with police and housing and codes. The items on the proposal, generally, the easiest way to say it is these aren't our programs. These are federal, the HUD stuff is federal money. The locals only services, the stuff that Wesley House does, the mental health, the Kansas Statewide Homeless Coalition tracks the information that they were asking about. And we went through each one of these and didn't see anything that's really under the guidelines or a program that we run. The one thing that did come out, I mean, Crawford County Mental Health was here tonight. The Addiction Treatment Center was one of the bullets in here. The Housing Authority, the Oxford House is a federally, I mean, it's federally protected. There's nothing we can do. We've been through that about Oxford houses. The parole board is interesting. We've talked to police. We have a couple of officers that are experts in how that works. There is a contact for the local parole office. It's not a city office. It's not a city position. So if you have questions about parole and how that's treated, that's, once again, it sounds like the same old shtick, but that is not the city of Pittsburgh's responsibility. CCAP, Catholic Charities, et cetera, what can be done? I mean, that's a question for CCAP and Catholic Charities. We do have the zoning was the third thing that I underlined that Roger brought up. The easiest way to put it from the city standpoint is we adopted a zoning ordinance 5 to 6 years after Wesley House went into operation. So it was grandfathered in, whether the services that they provide, and they listed quite a list. Food bank and pantries, clothing drives, shelters, counseling services, senior services, health services, disaster relief support groups, community events, volunteer opportunities. If those are services being, and please correct me if I'm wrong, if those are services that are being provided through there, then there's no zoning issue with any of that the city is aware of. But I'd love to put Dexter on the spot and make him say all that again too. But, we did go through it. I don't want anybody to think that we don't appreciate their ideas. I think everybody that's ever approached us with an idea, whatever department it is, we're going to look at it and we're going to give it some thought. But you know, we're restricted in what we can and can't do as a city. And there's a difference between the city and the community. And a lot of those are community organizations providing services with their money the way they want. And unless you all five see different, I don't see us wading into telling everybody else what we think, how they should do their business, but we will do whatever you want.
I highlighted some of this from last meeting, Darren, and I just want to read off something here. Out of the area of homeless do end up in Pittsburgh. Let's come up with city ordinance that restrict resources to locals. Daniel Minnis. I don't know what the ordinances are, but that's his suggestion. I can assure you that once word got out on the internet, your fears of other communities directing their homeless to Pittsburgh could not have been prevented. Krista Posey.
I would like to, that was taken out of context. That was related to the Code Blue.
I'm just reading off what's on this paper.
I'm just saying that was taken out of context.
Where'd that come from? That was
Kept going on.
I'm sorry, that's on this?
Yeah, go ahead.
Can I continue then? And I think this is kind of interesting. Conduct criminal background checks with Pittsburgh PD or Crawford County Sheriff's Department to allow to verify no warrants or fully legal activity. I think that's a good idea. I don't know how you do it. I'm sure these homeless people have to have an address. I think it's Wesley House. Some of them use and a name, but I think if we do a background check to make sure there's no felons out there in the homeless community for the safety of our citizens, I think that's a good idea.
Probably the only way you'd be able to do that is if they were arrested or.
Yeah, we can't just be
You'd have
background
to,
checking.
you can't just walk up to them and
Okay.
say, tell me about your background.
And who's gonna pay for it?
Do what?
And who would pay for the background check?
Well, I mean.
If it's an arrest.
If it-
Right, but I mean,
Yeah.
Yeah.
the
But, you know,
position.
if it could, I think it would be money well spent if we pay, whoever pays for it, if it could prevent a child or an elderly person from being harmed by a felon that's a homeless person. I don't think we worry about what's that gonna cost if we did a background check. But the good point you have there, Don. And here's something else. You know, we hear this, we've heard this before when it first started, that we can't prove that people are being dropped at the casino by a bus or a car just to gamble. You know what, can't verify it, but people have said they've been dropped there from other communities. But here's something else I want to read. There's evidence that correctional facilities have dumped homeless into southeast Kansas, Pittsburgh, and others have made it here on their own. Once discovered, the city has taken steps to eliminate the dumping practice. Daniel Menace, what have we done to eliminate that, Darren, if it is happening?
I'm not Daniel Menace, I didn't say, I don't.
No, Daniel Menace says the city has done things to eliminate that, so evidently he might know something that the rest of us don't, but.
That'd be a good question for Dr. I mean, if I get up here and speculate on everything everybody said about the city, we would never sleep. I mean, I have no idea, I can't answer that really.
Well, I think this whole thing is about, it's a concern for the safety of Pittsburgh, and I think that's why some of this stuff has been brought up. I think we do have, and I've said it before, I think there's some safety concerns that people have. I've talked to people in that area of Wesley House, residents. I've talked to business owners, and there is safety concerns. So, once again, I think this is, this group, that's their main concern, safety of our community.
Fortunately, we have a very capable police department.
Short-handed, short-staffed, they can't be
In the
everywhere at
Pittsburgh
same
Police
time.
Department.
And they're being worked very hard.
Well, and I heard you mention a 40%. I think we could probably dispute that, but, yeah, I'm not gonna argue it one way or another, but I do see the calls for service, and I see the calls for service of homeless versus, regular calls in my full-time position, and it's nowhere near 40%. I mean, there are some nights that are busier, that are with calls regard to homeless, but for the most part, that is a gross exaggeration of what the problem is, so.
Oh, yeah, I do not remember where that number came from.
Yeah, I don't either. So that's, that's another part. So sometimes we have to quantify where we get our sources at. And if we can do that, then, it's just out there, so.
I think I talked to Roger before, and there was a night, because I think I remember a conversation where it was like, one weekend, it was like, yeah, it was 40, I mean, on any given night, it may be half of them. But I agree with Stu, I mean, seeing that 8-hour report all the time, it's, but it's a real number, whatever it is, and to Chuck's point, and everybody's point, the people that were here for a half hour today, I mean, there's a lot of people working on it, and I don't ever want anybody to think they can't come in here and ask a legitimate question and say, hey, have you guys looked at this or thought of this? Because, we pride ourselves on whatever we can be doing, we're doing. And obviously, is it making a difference? I don't know. I don't know what it would look like if we weren't doing anything, but I imagine it would be worse, but.
People are getting housed. People are getting housed.
Well, I want to be real careful too, because there are some people that are caught up in the naysaying of the criminals that are out there that are homeless, that are just abusing and breaking, and then there's legitimate, I mean, like I said, we've had homeless here for a long, long time. That's why all these services are here.
Sure, and this is something that in talking about this and doing more research, myself and a lot of the people I've been working with have always advocated for, let's focus on the local people, do everything we can to take care of them, and people who turn up that are not from here, which admittedly there are quite a few, let's encourage, if not mandate, the charities involved to develop a return to home procedure that actually does that. That's a very common thing throughout homeless services nationwide.
But I think that's a difference. I think that's where it splits with what you're saying and what the providers are saying is, they don't care. The split that I see is the criminal side of it and those that aren't criminal. Who needs food, who needs housed, wherever they're from in Pittsburgh, they've always tried to take care of them. For me, the delineation is, the people that are the criminals in that mix are the people that we need to focus on and find out how to, that's who's dealing, the cops are dealing with, that's who we're
Right.
dealing with.
Completely
But
agree.
check, if somebody needs a meal and they roll through Pittsburgh and they thought they knew somebody here and they're not here and they get a meal at the Lord's Diner, I don't think checking their ID and saying, you can't eat here, you don't have any blood.
No, and I don't think that's not what most of us who have looked at this rationally are advocating for.
Well, that's what it sounds like when you say, I want to know where you're from, and you're not going to get services.
The concept of long-term services.
Well, I don't want to use your words. I'm just telling
I
you
understand.
what you said. It sounded like I get beat over the head a lot with, we're helping people that aren't from here. I'm like, aren't we just helping people? If people
We
want to
are,
help people, I'm not going to give
we
them
can help
restrictions.
ourselves into such a hole that we're unable to provide for local people when there are just a continuous stream of new people coming in.
So what's your evidence of that, Roger?
Well,
I mean, it's really easy to say those things.
the statistics on the point in time that Krista had published showed that 30% of the homeless at the time in January were not from here.
And that was about, what, 30, that was, the point of time was around 70 people.
Right.
So about 30% at that moment.
At that moment. And they've, we hear constantly that we've housed this many, and yet then, months later, a year later, the housing number is still as high or higher than it was at a given time. Where did all of those homeless come from? We've seen from the criminal charges, their arrest records, stuff that's published on the sheriff's site, that one person after another, the guy that tried to break into Our Lady of Lourdes Church a few weeks ago, he's from Nevada, Missouri. The guy who was caught passing counterfeit bills, he's from Michigan. This is going back a couple months ago. Guy passing counterfeit bills around town is from Michigan. He's homeless and he's from Michigan. What brought him here? And I know, and I guess that's our point. It's not that any of these organizations are putting out a help wanted ad saying come here for all the free stuff, but they get here, and it would be a humane thing to do to help that person return back to their home where they have a true support network, instead of just leaving them roaming around Pittsburgh, and in the case of public safety, the issues that we run into.
Well, unfortunately, in law enforcement, sometimes we have to extradite people back to the area that have left the area.
Understand.
And, that it's always, to me, it's always a catch-22. It's like, okay, well, they're gone. You have to go to Arizona and pick them up, but now you brought them back to our area. So there's always that. That's more the criminal element than the homeless, but, that's always, how they get here is, every one of them has a different story, Roger. I mean.
I completely agree, and the method of how they got here is less of a concern at this point than it is what you do with that person when you discover that they're a felon from Michigan, and they ended up here however they ended up. You can't put them on a bus at gunpoint, and we're not advocating for that. Some people think we are, but what you can do is encourage the organizations helping them to stay here to say, look, you're not from here, we're going to help you return to your home, but we're not going to give you carte blanche unlimited services.
I think we need to recognize that Pittsburgh doesn't have a lot of services for homeless. We have Wesley House that is day services. We don't have a shelter. We don't have, what some of the larger communities do. So there's not a lot of services for our homeless.
No, there aren't, but and that's just it. They're limited services anyway. And as more people are coming here, we see it routinely because there are more showing up and being arrested. That arrest record doesn't lie. It tells us that they're not from here.
That seems contradictory, though, when you say that they come here because of the services, but yet they come here and then they don't find the services. And
Well, there are enough services to keep them going with what they're wanting to do. I don't know, does that mean they burned bridges where they were and they're tired of being arrested there, so they come here open? They're not going to get hassled as much? I don't know.
I don't know.
But it's an ongoing problem, but it definitely does not appear to be getting better. It appears to be getting worse.
But that's a national trend. I mean, let's be real clear, because, we have these poor little city commission meetings and we broadcast them all over, and we spend so much time acting like that we invented homelessness and we somehow, it's destroying our community. And the reality is, We are out there every day battling to make this community safe and fun and affordable, and we do a great job, and people need to understand that those national problems, we share in those. We're a big enough city in Kansas that we have those problems. But like to Don's point, I mean, we also, and we're big enough, we're gonna have some services to provide meals and sheltering and whatever we can. But it doesn't define us, and I wouldn't say that it's so out of control that that the community's in grave danger. The safety of the community is the number one thing we do, and that's why I'm proud of the police to show up. They're the one, what I never see in this whole solution is when somebody's saying, hey, you know what, we wrote a grant and we've got 5 people that aren't police that are gonna show up and deal with these people every day. Because we're only dealing with the ones that are really trespassing and having, and so it's very confusing, but for the most part,
It's
the
never gonna be,
community's
it's
doing
never
very
gonna be a
well.
single solution type of a thing.
Well, but the pressure on this group and with this mic is to do something that we keep saying, if a church wants to reach out and help people, we're not gonna tell them they can't. It's just not gonna happen. That's not how
I don't want us to stand by and vilify the people that are offering the limited services that they have in this community. I mean, I think they should be commended.
They do a lot of good.
They do a lot of good, Roger, and I do think that we run the risk of vilifying them, and we continue to point out that, this organization and that organization are enabling this problem.
Well,
To Darren's point, that, we all share in this nationally, and we're not immune from it.
I don't know if you've been following the Springfield, Ohio thing, but if you haven't, you should follow it and see what's going on. But I just returned from 5 days in Denver, and let me tell you, it's bad in Denver. There's not a street corner you can go on that you're not accosted in some form or other, or somebody wants to do your windows and they'll step in front of your car until you hand them a dollar bill. It's either that or run over them, and they know if you run over them, they're going to get some money. I mean, it's incredible.
And that's
incredible.
that kind of drop in community quality of life is something that's very concerning.
It's horrible.
That if we say there's nothing at all we can do, we just have to let things happen, is that the best
But we're not
approach?
doing that. We're doing everything we possibly can at this point. Other than, if somebody wants to build a 100-room hotel out here to house the homeless, I'm happy for them, but they're going to have to run it and pay for it.
Unfortunately, what we've seen nationwide, when something like that does happen, you end up with 200 homeless. If you build 100
Well,
homeless
it happened in
shelters.
Olathe and it happened in Lawrence, and they ruined the building. In 1 year, the building was totally ruined.
Right, which tells us that traditional approach is not the way to go.
Exactly.
There
Which
has
is
to be a
why
better
we've had to
approach.
rely on our faith-based organizations to step up. So, I mean, I think we need to quantify some of the things that you say. I mean, they're very vague in terms of all the criminals coming in. I mean, I don't know how we can quantify all of this, but just, we throw out these vague terms and statistics on these meetings, and it becomes fact, and we don't know that it's fact.
Well, I guess gets to the point of asking the organizations when they're registering people, because they do have to register them when they're bringing them in when they sign them up for services, right?
Yes, but it's not the input, it's those that are interacting with our police.
Yeah, but that's what I mean, when a new homeless person shows up, they have to be registered per state law, however that's set up.
Well, if they go through, if they go through and receive services, yes.
Right.
Right.
And so at that point, is there not, I'm not talking about hassling somebody and pulling them off the sidewalk to run their papers, but to ask the organization to cooperatively run a criminal background check on the person they're signing up. Is that bad?
Well, number one, it's expensive. These are organizations on shoestrings, they're not.
I understand, and Chuck said it very well, that there's a certain amount of expense that's maybe acceptable in the interest of community safety and knowing who these people are that are coming here ahead of time rather than waiting until they're in the community and then they start offending and causing more crime. To me, that doesn't seem like an unreasonable request, not to put an additional financial burden on them, but in terms of what's out there, that doesn't seem like that, especially when we're factoring in the expense that we incur dealing with.
And obviously, everybody's can have their own opinion. The problem with that is it feels like you're asking this commission to pass an ordinance telling them they have to do that.
I'm asking them to cooperatively work with and ask the organizations if they will do that. We've never even asked. Not everything has to be a mandate. It can just be, say, look, let's try to get a handle on this proactively so that we know who's coming into the community. That's kind of the question.
You gotta remember, there is such a thing as due process.
And freedom.
Well, no, and that's what I'm not, this is a situation where they're coming, they're signing up for services. As Dawn said, it's not a matter of, hey, you're not allowed to walk down the street. It's a matter of if you want these services and these charities want to be good community neighbors, then let's ask them to do this in order to assure us that we're not bringing in bad elements into the area. Megan, right? Sorry. You mentioned about the not being allowed to put residency requirements with a time limit. There, you can when they're tied to something like a work requirement.
According to the CFR, it specifically states that we cannot. So when it says residential requirements or preferences, a residential preference may not be based on how long an applicant has resided or worked in the residential or the residence preference area. So that would be the city limits of Pittsburgh is our jurisdiction with the housing authority. So that's from CFR.
Okay, and I was just looking up the Housing Authority of Los Angeles uses that as one of their criteria. So there must be some way around
So
it.
you can put a working preference, but like I said, we do not put a working preference.
But you can.
Let me take
I just want to read real quickly now. I realize this is going way long. One of the requirements from the City of Los Angeles Housing Authority, which issues HUD vouchers, is working at least 20 hours per week at the state minimum wage and has been locally employed for a minimum of 6 months prior to the determination of eligibility. That's on page 2 of the document I gave you this evening. There are a number of criteria there that issue that meet the federal requirement and do establish some type of a residency preference that includes a time limit.
Roger, does that surprise you at all coming out of Los Angeles that they would have something like that?
Well, you know,
I mean,
For this.
I can't help but look at that and thinking, really?
I had the same thought, but I look at that as like,
Where did you get that at?
that's straight off of the Housing Authority of the City of Los Angeles' website.
Okay.
I can send you the link later on if you'd like to see it.
Right.
I think
But
that's,
just literally just Google that and it'll come right up.
So when I look at the CFR, it says preferences for working families. It says the PHA may adopt a preference for admission of working families where the head, spouse, or sole member is employed. However, an applicant shall be given the benefit of the working family preference if the head, spouse, or sole member age is 62 or older or persons with disability.
Right, there are gonna be limits to that.
Right, but you're also going to limit housing opportunities for single families that a child may be receiving SSI benefits because the child is so disabled that the parent can't work. So you're also, and they're local, or even fleeing a domestic situation and they're coming here and they're not local, you're gonna limit that housing opportunity for them.
And there are, I'll stop with this, but there are ways to write the annual housing plan to account for those situations. It doesn't have to be a zero tolerance type policy. It can always be adjusted to have some leeway for emergency situations like that. So I appreciate your time.
All right.
I won't keep you up any later. Thank you.
thank you.
Thanks, Roger.
All right. Anything else?
No.
Move to adjourn.
Second.
It's been moved and seconded to adjourn. All those in favor say aye.
Aye.
We're adjourned.